Healthcare, in partnership with AI-driven cardiac care company Tricog Health, has announced the launch of KeeboHealth, a new digital health platform designed to make heart care more proactive, accessible, and home-based. The two companies said the platform is built to connect OMRON's medical devices such as home ECG monitors and blood pressure machines with Tricog's real-time AI engine. The system is designed to monitor heart health continuously, detect early warning signs, and alert medical teams immediately when intervention is needed. According to both partners, this approach could reduce hospitalizations and help patients manage heart conditions more effectively from their homes at an accessible cost. Company leaders emphasize that KeeboHealth is a key milestone in OMRON's broader Going for Zero vision, aiming for a future with zero heart attacks and strokes through early detection and preventive care. Ayumu Okada, President and CEO of OMRON Healthcare, noted that the company has spent decades supporting heart health in India and sees KeeboHealth as a major advancement. He highlighted that by combining OMRON's innovative devices with Tricog's AI technology, the platform bridges the gap between home and clinical care. Dr. Charit Bograj, founder and CEO of Tricog, stressed that the platform represents more than technology. It offers hope. He said the ability to detect problems early, even in regions with limited access to specialists, could transform how heart failure is managed across the country. The platform has already shown positive results in a multinational study involving hospitals in India and the United States. Patients using KeeboHealth experience better exercise capacity, improved heart biomarkers, and increased adherence to treatment guidelines, leading to fewer hospital readmissions. With plans to roll out widely across India in 2025, the partnership aims to reshape how heart care is delivered, bringing smart, affordable, and personalized cardiac support to homes across the country.
Sir, I'm very proud to say that we are part of Karnataka's program, the Puneet Rajkumar Hidaya Jyoti scheme, to identify people with heart attacks and get them to treatment. And the state government has been one of the first adopters of not just the detection program, but also treatment program. Namma Karnatakadalli Tenictiplase anta 1 minute injection, we are one of the first states to implement this. This injection costs 40,000 rupees in the private hospital. It is given for free in all of the government centers where the program is running. And this has saved hundreds upon hundreds of lives. The government and Tricog is working closely to make sure that this benefit reaches every heart patient in our state.
So is this device user-friendly?
Very much so. The device is designed so that with very little training, this can be implemented across both urban, rural, and even the most remote locations of our country. Sir, we only have one heart. And the heart is one of the most unique organs in the entire body. In fact, the heartbeat starts before the mother even knows that she is pregnant with a child. And that heart lasts until our last breath. Keeping this heart safe and secure is our duty. Making sure we live a healthy life. Eating well. Preventing smoking. Minimizing alcohol. Making sure sugar, blood pressure either does not develop, or if it does, keep it well under control. All of these, when we work together, along with making sure we have good physical activity, moving and walking 1.5 hours a day, all of these help improve our heart health and prevent heart attacks from occurring.
Thank you. So we are going to demonstrate today an OMRON complete device to you. So I have a gentleman sitting here right now. What I'm doing, so this device basically takes two important parameters. One is a single lead ECG and second is a blood pressure. This is a cuff that is worn around the arm. So it's put like this and tighten up just like any other BP machine, BP device. And the arm is left on the table in a relaxing fashion. And we press the start button for the BP. At the same time, we can also in parallel take a single lead ECG. So what you're seeing on the screen is the single lead ECG being taken. It takes about 30 seconds of time for the ECG to come through, and on the bottom of the screen you will see the blood pressure also getting recorded. Both the things take about 30 seconds. Now, as we complete the ECG and BP, here are the results. So you can see the urine calcium. Thank you. So you can see the ECG came out as normal, and here is the ECG waveform, and here is the blood pressure report, which is again normal, and the pulse rate. So these three data points is what you can capture within 30 seconds, and these three are very important data points when it comes to checking the current condition of the patient, both from diseases that can be predicted from single lead as well as from blood pressure side. Thank you.
What is device all about? Like, how different is this device?
So the biggest difference between this device and any device available out there, you would see that this is the only device right now which can capture single lead ECG with a blood pressure. There are devices which capture single lead ECG independently and blood pressure independently. Now the benefit of having this device at home is, with the help of Tricog algorithms, we can risk triage the patient on bunch of conditions, more than 100 conditions, and allow them to go to the hospital and get checked when there is a need for that, when they are at a critical zone or they're at an abnormal zone.
Is it user friendly?
It is pretty user friendly, so it takes less than about 5 or 10 minutes for someone to understand the nuances of this device. All you got to do is use your smartphone, place it on top of this device, and like this one, and this allows you to take blood pressure and single lead ECG. So it's pretty user friendly. This is a home device.
Okay, how about if people want to purchase? How do they need to purchase it?
So there are multiple ways. It is available at the pharmacies. It is available at different channels. It is available at e-commerce website like Amazon, Flipkart, and other devices. And they can also contact Tricog, along with the KeeboHealth subscription if they want to enroll in this entire program. It is pretty cost effective from a long-term point of view, because a person getting discharged from the hospital probably would have spent a bill of couple of lakh rupees getting treated. So it's very important that the readmission is prevented, and the readmission rate can run as high as 30 to 50%. So compared with the cost of this device, it is extremely cost effective.
And what about the service and the quality?
So service comes along from Tricog side. The devices are provided from OMRON side. What we do in the service side on KeeboHealth is there is a care team which is aligned in between. This care team looks at the data. So we have just taken an ECG and BP. This ECG and BP goes to the platform, and there is a medical professional who look at the prognosis of these data points, and if there are any abnormalities that come up, the care team call the patient and inform them about those abnormalities, check more details, and recommend them the next step. For example, go to the hospital and get treated, or get an up titration in the medication done, change of the medication done. Those things are done by the platform.
No, I'm talking to the service, not like the machine gets spoiled.
Yeah, of course. So OMRON has a very large network of both service on the machine as well as delivery and the primary purchase of this machine. So it's available pan India through distributors, through pharmacies, and through e-commerce websites.